Hi, welcome to NEWSTART Now. I'm Don McIntosh, and I'm glad to be talking today with Dr. Brian Schwartz. Welcome, Doctor.
Well, thank you.
We're going to be talking about this today. It's,
the heart.
something that's like this, the heart. And you're a cardiologist, which just means you study the heart. What does that mean exactly? You went to school for medical school, then you went through a residency that looked at the heart.
Actually, residency is in internal medicine, and then there's an additional 4 years of training after medicine residency to specialize just in the heart.
So it's like 4 years and 4 years plus 4 years.
Yeah, when I turned 40, I told people I had played for 5 years, worked for 5 years, and the rest of my time I had been training. It's a very long time.
Okay, good. So there's probably not a better person to talk about what really happens when someone has a heart attack. I mean, what some of the signs and symptoms maybe, let's give a couple of those, and then talk about what's really happening when someone has a heart attack. Yeah,
actually looking at the heart, when someone has a heart attack, they immediately may feel a heaviness or a squeezing pressure in their heart. And that's the way of the heart to tell them that that part of the muscle to the heart is not getting enough oxygen. Mm-hmm. So what actually happens in the arteries, and there's 3 main arteries that go to the heart.
Yeah, point on there so you can see on your camera what happens,
Okay, so there's 3, so the heart pumps the blood to the whole body, but it also has 3 arteries that pumps the blood back to its own muscle. There's 1 artery on the right side of the heart called the right coronary artery, and then the left artery gives off 2 main branches. One goes around the back of the heart called the circumflex, and the biggest artery typically goes down the front of the heart called the LAD, or left anterior descending artery.
Okay. And so what happens then, they have that feeling maybe of crushing pain or whatnot for 3 to 5 minutes, and then and what's happening really?
So looking at the artery, the heart does an incredible amount of work. The muscle has to get blood supplied to it, oxygen supplied to it, just like all the rest of the organs of the body. And if that were to stop because the artery just suddenly constricts down or plugs off because of a clot or a rupture of a plaque, that would immediately cause necrosis or a lack of oxygen occurring to those areas of the muscle, which starts to die. And as it starts to die, it causes pain or discomfort.
Okay, so now that doesn't just happen all at once. I mean, that's a process maybe that builds up. I mean,
yeah, unfortunately in America, little fatty streaks start occurring in the artery even in newborn babies.
Newborn babies?
We now know that it can occur in newborn babies, and even through teenage years, those little fatty areas start to thicken. And this is a process that occurs over 40, 50, 60 years until it gets to the point where the buildup of plaque narrows that artery, and it may get to the point where due to excessive emotional stress or sudden exertion that you're not in shape for can just cause that plaque to rupture. When it ruptures, it exposes lots of agents to the bloodstream that can cause a blood clot to begin. And as that blood clot begins, it can shut down the artery completely, and that's what leads to a heart attack.
So it's really the plaque rupturing is not the big thing. It's the other things that it causes to put into action that's the big thing.
That's exactly right. There is a serious problem with the artery closing down completely. Mm-hmm. But what happens is the plaque ruptures. As the plaque ruptures, it exposes this lipid, which is like cholesterol plaque inside the plaque. Mm-hmm. And as that gets exposed to the bloodstream, the little platelets and things that cause a blood clot start sticking to that lipid core. Other things are released, such as catecholamines or epinephrine. And that causes spasm of the arteries. And once you disrupt one plaque in the artery, you can cause disruptions in other plaques and even have a higher risk for a stroke or a heart attack in a second area of the heart. And so there's mediators that flow throughout the whole body during a heart attack, not just affecting that one area of the heart.
Well, let's say I just want to avoid this. Let's say I have heart disease and I want to avoid it. And we got about 30 seconds for this, but I mean, because that can happen, but what can I do? I've already got heart disease. What can I make sure that I don't have one? Not make sure, but avoid it.
Yeah, once you already know you have heart disease, then you need to treat the big 5 risk factors. Not smoke, exercise regularly, know your cholesterol and make sure it's under control, make sure your blood pressure is under control, and control your diet, and make sure you're not obese.
Say those one more time for us.
Okay, so not smoking.
All right.
Avoiding diabetes and hypertension, knowing your cholesterol and having it under control, getting plenty of exercise, And in America right now, a big problem is obesity.
Okay.
And controlling diet is important for that.
We've been talking with Dr. Brian Schwartz. Go to NEWSTART.com for more information on this. We're glad that you joined us, and thank you for being with us too.
Well, you're welcome.